probably don't need this. All right. Hey, welcome to Buckeye Review update. I said, I apologize. I'm going to try to be mindful of that. But tonight we have the privilege to have a conversation in Black about health. The goal of the Buckeye Review is communication, education, and motivation. And tonight we are in for a treat because we have a distinguished physician, surgeon with us to bring us great information about how to keep ourselves healthy and protect ourselves from misinformation and disinformation. And before I introduce Dr. Farmer, I wanted to give you a Black history fact about inoculations in America. We're dealing with the vaccine right now, right? The vaccine in America, and people are, I'm going to take it, I'm not going to take it. We've taken vaccines for years and years. They talked about the 1918 flu, and how everybody took vaccines. But where did they start? In America, actually, it was an African American. Well, it was an African whose name was Onesimus, and he was owned by a minister in Boston named Mathers, and he learned about inoculations against smallpox from his African enslaved person. Now, he knew he was very intelligent, but he didn't believe him. And it was like 1707. Hear me? 1707. It was probably 15 years later when he saw a journal from Britain, Great Britain, and talking about inoculations and taking a little piece of the pus from smallpox and then putting it into a person just a little bit. They'll get a little bit sick, but then they'll be inoculated from the disease. Well, Onesimus was his name. Now, enslaved people didn't have whole names. They just had names that were given to them by their enslavers. That's an unfortunate fact of American history. So while we like to say Black history is American history, or it's a Black fact, it's a fact about inoculations in America. And that's before 1776 America. That was colonial America and was brought to them by an African enslaved person. Further research will let us know that actually happened in Africa probably 100 years before Great Britain knew about it. So I just wanted to mention that as a Black history fact, and we're going to have more Black history, but we're really talking about history and how it affects all of us. I have this personal thing about Black history because history is history, right? It's not black or white. It's not wrong or right. It's like facts from the past that impact us now. So anyway, that's our Black history fact. Tonight, we're going to be having a conversation with Dr. Farmer. Let me introduce her right now, Dr. Farmer. And I don't have your bio in front of me. And I meant to have it so I can make it really nice. But you know what? I do have it. I do have it. And what I'm going to do, can I hear you now? Can
you hear me?
I can.
Can you hear me?
I can. Can you hear me?
I can hear you.
I can hear you now that I have these headphones on. So I will put your bio up and it's going to scroll underneath while you're talking.
Oh, how fancy is that? I love it.
It would be even more fancy if I could read it and then also scroll it, because we'll be talking for a while. You'll be talking. I'll try not to interrupt. But because we're Facebook Live and we're YouTube Live, I will be monitoring the comments and the questions. Okay. So I'll try not to interrupt, but if there's a lot of activity, I may interject or put it in the chat. But for now, I want people to know that Dr. Farmer is a phenomenal person. She's a phenomenal surgeon. She's an entrepreneur. She's a mother. She's a wife. She's a community servant. And she's also an AKA. Anyway, we're happy that she is a columnist for the Buckeye, contributed to the Buckeye Review. And so this is a feature brought to you by the Buckeye Review News. And our subscribers, our followers, our listeners are in 200 cities and 26 states and on the internet all over the world. So I'd like to take this opportunity to welcome Dr. Tanya Farmer.
Thank you. Thank you so much. Thank you, Dr. Mike, for having me. And of course, your lovely wife and Dr. Linda as well. I appreciate the opportunity that you're giving me to talk to your audience, and as well as the opportunity that you give me to share what I love and is all things ear, nose, and throat and wellness. And I'm able to do that through my column in the Buckeye Review called Dr. Knows Best. That's nose, Dr. Knows Best. So
Mhm.
I don't know if my bio is scrolling. I can't see that, but I
Okay.
can, just say that to everyone, I am a board certified ear, nose, and throat surgeon. I've been practicing in private practice here in Ohio for 20 plus years. I'm the co owner of the Lippy Group for Ear, Nose, and Throat, the Lippy Hearing Aid Center, the Lippy Allergy Clinic, and the Lippy Outpatient Surgery Center. So, and all those other things that Dr. Mike mentioned as well. So,
And they will scroll shortly. And
okay,
so you'll be talking, people will read it because people will tune in, after
right,
we've started. You might be well into the conversation. Then when who's talking, why, and so we'll make
right.
sure we keep it moving.
Absolutely. And I want this to be, a pretty interactive, if it can be, conversation. I was asked to come and to give some update information about the COVID-19 pandemic. I'm coming to you straight from ear, nose, and throat world looking like this. So thank you for having me as I come. But I was asked to come and speak about that information. If any viewers have any questions, if there's a chat, put it in the chat. Dr. Mike, stop me, and I would be more than happy to answer questions as we go. And we can also allow some time at the end to answer any questions also. Okay.
Awesome.
Do you want to go ahead and start the presentation, or do you want to talk about some other things first? Or
I want to know, did you hear what I was talking about, the history of inoculations in America?
a little bit I did, yes.
Right. So I guess I wanted to start there because
Mm-hmm.
of the conversation around vaccines and inoculations. And
Right.
because it's African American History Month, and
Mm-hmm.
inoculations were introduced into our nation by an African, I
Yeah.
thought that was really significant.
Yeah.
And then we have this it's become politicized for some reason, and so now people are kind of lining up. I'm on this. I'm an anti-vaxxer, and I'm doing my own research. So
Right.
the overall impetus of our conversations in Black this month is disinformation versus
Mm-hmm.
misinformation. So we know,
Right.
and I'll just put it out like this: a misinformation is I have bad information. I just didn't know. I
Right.
made a mistake. But
Right.
disinformation is a negative
Intent.
uh, impact with a diabolical reason. I want to
Right.
hurt someone with bad information, so I'm going to pump it out there.
Malintent.
Pump it.
Absolutely.
Yeah. So
Yep.
we want to combat disinformation and misinformation. So that's
Right.
why we bring on an expert, someone who knows what they're doing. And hey, what can you say to people that say, I'm just doing my own research. I think coronavirus is going by the wayside. I think I'm good. I'm young. I'm
Right.
healthy. I have a strong immune. What do you say to them? And then
I
you can take off from there.
I think that, anti-vaxxers and having some mistrust with vaccines is nothing new. It honestly, it's nothing new. There've been a lot of vaccines that have come recently where people are still questioning whether it's needed or the safety of it. So it's nothing new. But I do think that with the COVID-19 pandemic, it has definitely leveled up in the not so good way the disinformation and misinformation. I think that it's from the top down. And not to get too political on this,
Hmm.
in this conversation, but I truly, truly believe that if we had a different leadership when the COVID 19 infection hit our country, there would be a different outcome today. I truly
Hmm.
believe that. And I think that there would have still been a subset of people who we could still call anti vaxxers, but I don't think that it would be such a divisive amount if
Hmm.
things were done in a different
Right.
way. But I think that we in the medical field, and I appreciate you having me, because I think some of us in the medical field have really been feeling attacked lately. I went to school for 13 years to train in what I did, and that's not counting high school or anything. This
Hmm.
is all of the training, and some of us have even more training than longer than that. Between 13 to 16 years of training if you went to a
Hmm.
fellowship. So it's almost like that is being negated by a lot of people. Like, what do we know? What do you know? What do you know?
Right.
I'm going to go on YouTube University, or Facebook
Right.
University and get my information. I think that there has to be a balance. I think that everyone should absolutely be intentional about their health and decisions that they make for their health. And I think everyone should be involved, and they should take that step to do their quote unquote own research. But the problem is that where you go looking for that information, you cannot always depend on those sources. And this time of day now, with social media and just all the different kinds of outlets, you don't know what is true and what's not true.
Right.
And those individuals and organizations like the CDC and the FDA that we used to put up here as far as trust,
Hmm.
because of the politicization of the virus, it's almost like they've tried to knock them down. And now there's a large population who looks at them with mistrust. And I think that that's a really sad, that's a sad thing. So this conversation and the presentation tonight, I really wanted to just present some updates as it pertains to the COVID-19 pandemic. There's so much information and it changes so fast. And I think that also lends to why there's a lot of confusion around a lot of things. So I'm going to try to target a few topics and put the information out there. They're topics that I think we are starting to see more in the news these days and that we're talking about a lot, like such as the variants and the vaccines and things like that. And the mask and isolation and stuff. So I want to try to target those things. So I put it in a form of a PowerPoint presentation. I don't know if you can share that with our audience or if they can see that or not. Okay, there we go. And I think I don't know. Oh yeah, I have control. Okay. So
Awesome.
yeah, everything's working. Don't you love it when
Right.
when everything works?
Right. Wish more of it works.
Cross our fingers, right?
Right. Right.
So if you have any questions as we're going through the presentation, then please put your questions in the chat box. I want to make this interesting and I want to make it very plain and easy to understand. The focus topics that I'm going to talk about first are the numbers. Then we're going to spend some time on the variants, the vaccines, and then we're going to talk about some of the mask and isolation updates and where I think that there may be some confusion behind the information. And I'm going to share just my personal opinion about these updates with everyone. And then lastly, we'll just leave you with some preventative care information. So let's go to the numbers. This is information as of yesterday, February 9th. I put sources on each of the slides so you can see where the information is coming from. But worldwide, the total number of cases of COVID-19 is 403 million, almost 404 million cases of COVID vaccine. And again, this is actually a low number because this is not the updated numbers as it pertains to today. This was information from yesterday. Deaths, unfortunately, from COVID worldwide are 5,795,662 deaths. And when I look at these numbers, we have to remind ourselves that it's not just a number. This is an individual. This is a human being that has lost their life to this horrific virus. The total number of coronavirus cases in the United States is 78,824,393, and total deaths in the USA as of yesterday are 936,000. We are getting close to that 1 million mark. And that is not a mark that we should be proud about at all, unfortunately, to have lost that many lives. The total number of individuals that are vaccinated in the United States is about 65%. Now, if we go to the numbers in Ohio, into our home state here, about 2.6 million cases of COVID have been identified and almost 35,000 deaths. Again, this is information from January 1st of 2020, when we kind of first started tracking the COVID numbers up until yesterday. If we break it down into Trumbull and Mahoning County, total number of coronavirus cases in Trumbull County are about 41,000, and in Mahoning County, about 53,000. Hospitalizations in Trumbull were about 2,100 with COVID, and in Mahoning, 2,000. And the total number of deaths from coronavirus in Trumbull County, almost 850 lives, and compared to 1,003 in Mahoning County. So let's turn to vaccinations and look at our vaccination rates. Looking at numbers 5+, the individuals who are 5 years of age and up that have been vaccinated in Ohio, we can break it down into 3 different categories. Those who have been completely vaccinated, meaning they've received 2 doses of Pfizer or Moderna or 1 dose of the J&J vaccine. 6.6 million individuals, or about 56.24% of the population in the state of Ohio, have been completely vaccinated. Those that started their vaccination, meaning they may have received the first of 2 series, is 7.1 million, or 61%. The additional doses, we think of that as those who have been boosted for the vaccines, and that is 3.3 million. If we just break it down and look at race, and I know it might look small, I don't know on the screen, but if we break it down based on race, and I'm just looking at white to black, the white population, about 77%, or 5.1 million people, of that 6.6 million completely vaccinated are considered of the white population, and 9.7% of the Black population. Now, keep in mind, if we look at the statistics from the census, from census.gov in the state of Ohio, about 11,780,000 our total population in Ohio, and it breaks down to about 13% white to Black. Okay. Now, if we look at vaccinations in Trumbull County, for those numbers I gave you were for vaccinations in Ohio. Now we're going to look at Trumbull County and Mahoning County for those 5 years of age and up. Remember, I'm saying 5 years in age and up because there is no vaccination that is there out for those who are less than 5 years of age yet. It's coming, but it's not here yet.
Okay.
So those who were totally vaccinated, we're looking at 54% in Trumbull County, about 102,000. Again, this is data from as of yesterday. And in Mahoning County, 124,000, or 57.5%. Those who have started their vaccinations, it's about 58.9% and 61.9% in Mahoning. Those who have those individuals who are 12 and up who have received vaccinations additionally, or boosters, again, remember, There's no booster. Well, not remember, you may not know. I'm here to tell you there's no boosters for individuals who are under the age of 12. We are only getting boosters to those individuals that are 12 and up. So those who have received booster doses in Trumbull County is about 52,000, and those in Mahoney County, 62,000. So those are the numbers when we look at it. So what I take away from those numbers, Dr. Mike, is that we need to continue to immunize. We need to continue to vaccinate. We need to increase these numbers and get these numbers up higher. I do think that depending on what the political landscape is of your state plays a big role. But Dr. Mike, that's a whole nother conversation, right?
Right, right.
The bottom line is we need to continue to push vaccinations because we know that that is the best way that we are going to slow down this pandemic. So let's turn our attention to the variants. We are hearing about variants all over in the news. It is the biggest thing. So what is a variant? What are we talking about? A variant is basically just a mutational change in a virus that makes it different in certain ways from the original virus that came out. So as that original virus comes out and it's replicating and different bodies and all of that, there might be some minor little, missteps and mistakes as it's replicating. So it comes out with a whole new variant. So I kind of put a picture up on the slide to give you a visual of what that kind of looks like, right? If we look at the SARS-CoV-2, which is the virus, the original virus that started out for COVID, think of it as that naked tree, right?
Mm-hmm.
But we know that it's going to grow. We know it's going to expand. We know that it's going to replicate. It's going to grow into a newer tree. It's going to grow leaves. It's going to grow new branches. So think about the Delta variant, okay? Here came a variant of that tree, but the basis, that foundation of that tree is still the same, but there are little things about it that are different. Hence the Delta variant, right? Now another variant might come out, like the Omicron variant that we're dealing with right now. Again, the foundation is the same, that SARS-CoV-2, but there's different variations of it that make it even different from Delta. And now the picture that I put up there was intentional. The Omicron variant looks bigger, right? It looks bigger and stronger. Well, we know that the Omicron variant has had a higher transmissibility, meaning you can get this Omicron variant much easier than, say, the Delta variant. We have been finding that it spreads much easier. So think of the tree analogy when you think of variants. Okay, I hope that makes sense.
That makes
sense.
Now
let's briefly. Okay, good. Let's briefly talk about the classifications of variants, okay? This slide looks busy, but I'm going to make it very easy. The CDC classifies variants into 4 different categories. We're only going to be concerned about 2 of those categories because they've only identified variants in these 2 different categories. One is called the variants that are being monitored. These are different variants of the COVID-19 or the SARS-CoV-2 virus that have been out there, that have caused some degree of disease in individuals, but the levels are so low circulating in the population that it's really not even all that significant. So they're kind of like, all right, we see you, but we ain't worried about you, okay? You ain't doing nothing much, okay? They're considered variants that are being monitored. And then you have variants of concern. There is clear evidence that there's an increase in transmissibility, just like we talked about with Omicron variant, more severe disease, or a significant reduction in how vaccinations are working against it, reductions in the effectiveness of the treatment or diagnosis of these variants, okay? So variants of concern. Now, the CDC is like, okay, we keep it more than one eye on you. We are focused on you. We're very concerned about you. So if we look at these 2 different categories, variants that are being monitored, there's a lot. What most people don't realize is that there have been numerous variants that have circulated in our population. And guess what, Dr. Mike? There's going to be plenty more.
Mm.
Variants are extremely, extremely common. We know this from other viruses, okay? It's extremely common. If you're familiar with the Greek alphabet, you can run the list here of all of the different variants that have circulated in the population: alpha, beta, gamma, epsilon, eta, iota, kappa, mu, zeta. I feel like I'm at a sorority function, right? There's a lot of variants, but those are the variants that are just being monitored. Okay. We're not so worried about them. There's two variants that the CDC has classified as variants of concern: the Delta variant and the Omicron variant. The Omicron variant has now become the predominant variant in the population. It was first identified in South Africa. Now, I want to be clear about this and not spend too much time. It ain't like it like the Africans started it. And that's not where Omicron came, because there was a lot of fallacy around that. Okay. And then our government reacted by restricting, travel to Africa. It's just that our African brothers and sisters are intelligent and they identified it there. Okay. It
Mhm.
wasn't thought that it actually originated there, but it started here. And we first identified the first case in the United States on December 1st, 2021. And again, it has taken over and has become the major variant that the CDC is concerned about.
Before you continue,
Yeah,
it's just the fact that how quickly, so it was identified in December, we're barely out of January, and it
exactly.
literally taken over as the major
Major.
variant.
I remember seeing a news segment with Dr. Fauci on it, and I remembered him saying, this was before Omicron was really big here, and he said, "Well, we're not too concerned yet about it, but we're keeping an eye on it, et cetera, et cetera." And then it was like in a matter of like a week or two, it was like, whoa, Omicron just really, really sprouted itself and spread its wings across, the United
Mhm.
States, and has now become, the dominant variant. So these variants can really take off, or sometimes, Dr. Mike, they can just fizzle out. They can fizzle out and not really become anything. So it is important that we have these agencies like the CDC looking and monitoring continuously, continuously, continuously. And that's why things are changing so frequently, so rapidly. And it's important that we have presentations like this so that everyone can be on the same page and understand the information that's coming
Mhm.
out.
And
Okay.
also, I just want to also mention that these information comes out rapidly, but it's published in journals and it is peer reviewed.
It
It
is.
is scrutinized, and we really have to be paying careful attention. So, for people who say they're doing their own research,
Right.
and, they really are either being disingenuous or they
Right.
have to spend a lot of time doing it, because if they did, I mean, there's a lot of international cooperation in the
There
medical
is.
community. Apparently, so the health and the longevity and the life expectancy of humans on the face of the earth has been
Right.
extended because of medical science that's being talked about. And we appreciate you bringing this to us. But I just wanted to mention it only from the standpoint of our audience. We don't know
Hmm.
who our audience is. I mean, everybody has their own, like, who do you listen to, right?
Right.
The people we meet, the books we read, the social circles that we travel in. So
Hmm.
we're bringing it to a different audience, or a wider audience, and that's why I
Right.
just wanted to affirm. I didn't mean to interrupt you, but I just
No,
wanted
no,
to
no.
affirm the importance of. I mean, you're bringing us a whole lot of stuff, right? But it's very, very important, because people,
Yeah.
they get, uh, they grab hold of a few sound bites. Oh, see, things
Right.
change. It must be wrong, right? Oh,
Right.
I mean, that's
Right.
life. I mean, life changes, right?
It does change. And I think that's one of the things with this pandemic, is because it's such a rapid change. One thing we tell you this day might be different this day, or the next week or the next month. And I think that we have to, towards the end of the presentation, I talk about this, but we do have to give our leaders grace. we have to give these agencies grace when it comes to the information. I'm not
Mhm.
saying that they're perfect with messaging and all of that, but we do have to understand that it's such a rapid thing that we're going to expect there's going to be different information.
Mhm.
Plus, this is a new virus. This is a brand new virus here that we're learning, that what we know about the virus today is way different than what we knew 2 years ago. Okay.
Mhm.
The way we're managing the virus and diagnosing the virus is way different today than it was 2 years ago. So when we gain that information, we're able to improve our knowledge so that we can put it out there to the general public.
Mhm.
So I want, I think it's important for us in healthcare that we meet people where they are and that we try to explain things in very simple terms, because sometimes I read stuff and I'm like, oh Lord, that was, man, I'm scratching my head. Like that was
Mhm.
confusing. So you
Mhm.
have to try to, make it make sense. And that's why I think conversations like this are very important, for the general public. So, and if we go into the vaccines now, and this is, I think, an important point too, Dr. Mike, you were alluding to, is that work on these vaccines have been going on for a long time. Not that they knew about COVID-19, but what I'm saying is the general basis, the pathophysiology of how these things work, the messenger RNA has been going on for a long time. We've been investigating this. We're looking, we should always be ahead, thinking about how we can better do vaccinations. So when this virus came to be, it was like, okay, we got something, we got some big guns we're going to pull out, on this virus. But I think because it was such a novel way of dealing with vaccinations, the messaging behind it, it was difficult for a lot of people to get on board and trust the vaccines. But it
Mhm.
wasn't rushed. It wasn't something that was just made up. The whole premise behind the messenger RNA vaccines has been going on for many years. We've been investigating it. So if we just spend a little bit of time looking at the vaccines, there's three that are available in the United States: the Pfizer, Moderna, and Johnson and Johnson. Um, Pfizer is the one that is identified for those individuals down to 5 years of age. Moderna and JJ don't have that indication. It's 2 doses each for Pfizer and Moderna, and 1 dose for the J&J vaccine. As it pertains to the booster, as I said earlier, there is a booster available across the board for all three vaccines for individuals over 18 years of age, but those who are 12 years of age and up can only receive, or between 12 and 17, I should say, can only receive the Pfizer. If you're 18 and up, you can receive either three of the boosters. And you can also switch. If you receive the J&J vaccine to begin with, you can receive the Moderna or Pfizer as a booster. You can do that, okay? And you're fully vaccinated or considered fully vaccinated after 2 weeks after you've received your second dose of Pfizer or Moderna, or after your first dose of the J&J vaccine. Initially, the effectiveness, these percentages were really for the initial version of the SARS-CoV-2, but we do know that as variants come, the efficacy of the vaccines decreases. And that's why it's important to get the booster shot, so that you can just kind of boost your immunity to these variants that are coming along. Two things, to just throw out there for piece of, thought is, perhaps, I know they're looking at possibly an Omicron specific booster, because they were seeing that the vaccinations that are out there weren't as effective against Omicron. The good thing is that the Omicron virus, while variant of the virus, while it was highly transmissible, more so than Delta, the symptom profile was milder than Delta. Not that you couldn't get seriously ill and die from Omicron. Yes, you can. Just in general, the overall profile was a milder symptom profile. So could there perhaps be an Omicron specific booster? Perhaps, but I just want to say I would just be a little weary and cautious and say, what next? Do we have to come up with a booster for every single variant that comes out? That's just doesn't seem very feasible. So I know that, the scientists and experts are working on this. Might this become a yearly immunization? I do think that that's highly possible. Let's look at the flu vaccine, right? We take the
Hmm.
flu vaccine every single year. That's just something that we have come to accept, right? So I think it's going to be like that. You know, we have to learn to live with COVID. It's not going away, it's here, and we have to learn how to live with it. And I think one of those ways is that there's going to be a yearly immunization for COVID.
I'm glad you mentioned that because even the efficacy of the vaccines, as they have been proven, with
Mhm.
75,
Right.
95% efficacy, the flu vaccine that we take every year has a far lower,
It's less than that.
it's like 50%. So I
It's
don't know what
less
the
than
number is.
that. It's yeah. It's
Right.
less than that. And one of the reasons is because, there's so many different viruses, so many different flu viruses that are out there that when they make the vaccine, that has to be made ahead of time, So you're
Mm.
trying to predict which versions of it are going to be the predominant ones that are causing influenza that particular year. So you're trying to do this prediction and make a vaccine where you're not going to cover all of them in the vaccine, so the
Because they're
efficacy.
working, they're working on the tree, but they don't have
Mhm.
all of the leaves. And I love
There you
that
go. It's
graphic, because the
exactly,
tree
exactly,
blossoms and it's okay.
exactly. So we know that the efficacy of the flu vaccines have even been less than what we're seeing with COVID.
Got frozen.
Can you hear me?
I can now. There
Oh,
was a
okay.
there was
I'm
a
like,
brief
oh, we went
freeze.
away.
Okay.
That's why we in the healthcare field, we're really excited about the efficacy of, the COVID vaccines. So
And so I
moving
did
on.
get a question. I see a question in the chat about
Okay.
how long does the booster last?
So that's a good question that I can't answer and that I don't think anyone can answer at this point,
Okay.
only because the booster is something that's fairly new out as well. And we're going to have to see. I just received the booster. It was in November, I think it was like kind of after Thanksgiving or so.
Hmm.
So, how long am I going to have that protective immunity? We're going to have time is going to tell. We're going to have to see what those immunity levels, those antibody levels are for a booster. I think that if we have to start getting boosters every 2 months and every 3 months and all of that, it's really going to I think people are going to have a big problem with doing so and not
There's
wanting
al-
to do
there's
that.
already this fatigue over just
Exactly.
the
Yeah,
virus and the
people
mass and the
are
restrictions.
they COVID fatigue, they vaccine fatigue, they mask fatigue, they're everything fatigue. So at this point, no one can tell you that, oh, the booster will give you a 6 month, immunity or a year immunity. No one really knows right now. It would just truly be a prediction.
Here's another question. It's clear because of the fatigue you just talked about that a lot of mask mandates are being lifted.
Oh yeah.
Um,
We're gonna when I get to mask, we were gonna talk about that.
okay, okay,
That's a huge thing. We're getting there.
okay.
So back to the slide, I threw this one in. The last time I gave a presentation like this, we didn't even have this information, and now we do. They are working on a vaccine for children less than 5. There's a lot of parents out there that are saying, when is it coming? Because with Omicron, when Omicron came in, we started to see a really high rise of hospitalization in the pediatric population.
Mhm.
So the Pfizer company, they filed an application on February 1st with the FDA, where they asked them to extend the emergency use authorization for this age group. And a meeting is supposed to be set next week with the FDA advisory panel to vote on that approval or to disapprove extending emergency use for this age group. Now, this timeline might change, but the information that I last was able to obtain, this was the information. And then back to your point, Dr. Mike, that after that, there's a process. There's a process that happens. Then once the FDA advisory panel votes, then it goes to for FDA authorization, and the panel, the agency has to weigh the panels vote and decide whether to extend that emergency use. Then the CDC advisory panel has to vote on this as to whether the newly FDA authorized vaccines should be recommended for all of the ages that they asked for or just for a certain subgroup. And then the CDC has to make a recommendation. Director Walensky has to decide whether she wants to endorse it. And then it will become available to the public, where it will be distributed to pediatricians or to pharmacies. So when do I think that a vaccine for children less than 5 will come out? It may not be until March sometime that we start to see something like that rolled out. But the sooner the better for that pediatric population, age population.
Awesome.
So, what are some barriers to vaccination? We already know one of them is racism, right? We already know. We already know that when the vaccine came out, there were some populations in this country that were targeted to receive the vaccines, over others. Okay. We also know there's a cultural history when it comes to vaccines and just mistrust in the Black and Brown community because of experimentations that have happened with our ancestors. And then the dis and misinformation, Dr. Mike, that you had talked about and did a great job in differentiating the definitions of those two. So you can hear a little snippet here or there and you just believe it, and one of them was, if you get the vaccination, they're actually injecting a microchip in you. That was the opportunity for the government to inject a microchip, or that, these messenger RNA vaccines were actually injecting material into your DNA and going to change your DNA. This was a lot of fallacy, but it has become something that people grabbed onto and they believe, and that has become their barrier to getting the vaccine.
Right.
Messaging we talked about, could our government has even the past administration and even our current administration, could we do better with messaging? Absolutely, we could. And then there's access. We already know that the Black and Brown population oftentimes has a difficult time with access, even something as simple as having transportation to the pharmacy or transportation to a vaccination site to receive it. So there's many barriers to vaccination that we have to continue to fight against and that we have to continue to try to improve. All right, so let's roll to the mask mandate. Dr. Mike, I never asked you what my time limit was, but we're rolling. We're getting through these slides, okay?
Right. Let's just roll with it. Give us your best shot.
Okay.
And the good news is, because it's Facebook Live, it will be there for people to pick up later.
Good.
It's also on YouTube.
Awesome.
So give us your best, and you also listing your sources from the CDC and the FDA.
Yeah,
it's very important for those who want to go and do their own research. If they're going to spend a dozen years or more reading all of that. So we appreciate the fact that you're our expert, and we appreciate, and so you're part of our network, and we want to expand that network of wisdom and good scientific health information so we can live longer and better.
Absolutely. So when it comes to the mask recommendations, the CDC did update the mask recommendations, and they're even updating them even since this information was put out. But it was updated to say that they want people to wear the most protective mask that you can, that fits well, and that you will wear consistently. They felt that they were even leaning towards recommending people use N95s or KN95s over cloth mask, okay? Before, cloth masks, multi-layered masks, tight woven fabric was the thing and accepted. And in the beginning of the pandemic, because of the short supply and low supply, that they wanted to really steer towards the healthcare industry and hospitals and things, they were recommending that the public, that fabric mask and cloth masks were fine. But now the CDC was saying, try to wear more protective mask. But they said, listen, any mask is better than no mask, okay? But you want to have one that is really tight fitting and that you are going to be comfortable in to wear consistently. So the N95 and K95, what's the difference between these two. The N95 is kind of like the gold standard. That's what we use in the hospitals. We also use K95s in the hospitals. And the real difference for the general public to understand, the real difference between N95s and KN95s is where each is certified. These masks go through certifying agencies, and the United States tests, certifies, and regulates N95s. Manufacturers in China, they test KN95s, but the country's government doesn't have a regulatory body that's validating them. So that's really the difference between K95s and N95s, right?
Mm-hmm.
So on the screen that you'll see some pictures, of some K95s and N95s. The one in the center, I don't know if my arrow can point to it right here. This is what we look at as far as N95s here that have the double straps. Typically, when you see the double straps like this, these are the N95s and K95s. These are like surgical masks that we wear in the operating room. Mm-hmm. So some important things to know: any individual 2 years of age and up should try to wear a mask when they can. You want to wear the tightest fitting mask. Double masking is also important. So that means having 2 masks that you wear, and wearing the mask that fits the closest to your face, and then covered by another mask. Gaiters or handkerchiefs, the gaiters, the ones that you can kind of pull up, that kind of cover your neck also. That and a handkerchief type of mask are the least effective as far as being protective. And you want to try to avoid masks that have vents in them. That's what this picture is up here in the upper part with the X next to it, where this vent here, because it's felt that viral particles can easily get through these vents and make this mask less effective.
I paid a lot of money for that kind of mask.
Right.
I thought it was so cool. Cool, but not effective.
Cool, right? They look cool, but they're not recommended. So I just wanted to kind of demonstrate the double layer mask. This is a KN95 type of mask. It kind of looks, where's my camera? It kind of looks like a duck bill, here, but it has a moldable kind of nose piece here, and it has straps that go around the ears. And when you put it on, it fits pretty tightly to the face. Okay, you can see that. So if you're going to double mask, this is the mask that you want to put on your face first. Mold that nose piece down to your face. And then you can come in with a second mask. This mask is not as tight fitting to your face. And then you're going to put that over that mask. Okay, so that's how you would properly wear 2 masks. You don't want to do the opposite. I've seen this out, and it takes all I can to go up to the person and say, you don't have that on right. Can you switch it? But you don't want to put this mask on first and then cover with this mask. Okay, it's the opposite way. Another trick to make an ill-fitting mask fit better: if you have a mask like this here, then one way that you can put it on and make it fit better, if you look here, then you can kind of see it's not really fitted to my face. If you take this mask and fold it in half, right? And then where the ear loops are, make a knot, and make that knot close to the mask here, close to the end there, right? We're going to do that on both sides and make that knot as close as possible, right? So now when you open it, it kind of looks like a cone, right? Kind of like the other mask, the KN95 I showed you. Now when you put that on and you put the ear loops on,
look at that.
It looks more like a duckbill, right? But look, Dr. Mike, I still have a hole here,
yeah.
right? So now what you do is you want to tuck that in. Tuck it in where that knot that you made here, that will tuck right in, right? That will tuck in. And now look at the closeness here. Look at how close and tight fitting that is compared to what it was before. That simple trick, put it in half, tie a knot close to the mask, and then when you have it on, tuck that edge there. Okay. So that's a trick to make an ill-fitting mask a tighter fitting mask. Okay.
Nice.
All right, let's move on to just the isolation. This was another mandate that came out with some controversy. I'll tell you two industries where the controversy was the most was in the healthcare industry and in the flight industry. Okay.
Get ready,
So
get ready.
exact flight attendants were like fighting over this, like what are we talking about, because it was like they were being asked to return to work in a shorter period of time if they were exposed or had COVID. So the CDC said, they were shortening the isolation and quarantine down to 5 days. Remember when COVID started, it was 14 days. It was 2 weeks in isolation. Then it went down to 10 days, and now it's down to 5 days. And what it was said, the quote was that the change was motivated by science, demonstrating that the majority of the SARS-CoV-2 transmission occurred early in the course of the illness, generally within the first 1 to 2 days prior to the onset of symptoms and the 2 to 3 days after. So that's how they got that 5 days. They were saying that time after the 5 days, you weren't getting as much, transmission. So that's how it changed to 5 days. Okay. So now if we go look at the recommendations, there is a question that popped up, Dr. Mike.
Oh yeah. Sorry.
That's okay. Is there a way to make that go away?
Okay.
Or,
Yeah,
okay,
we
there you
go.
go. Okay. So if you test positive for COVID, okay, if you test positive for COVID, this is for everybody, regardless of what your vaccination status is. If you test positive, you stay home for 5 days. If you no longer have symptoms or your symptoms are improving or resolving after those 5 days, then you can leave your house, but you should continue to wear a mask for an additional 5 days. So you want to wear a mask anywhere you go for an additional 5 days. But if you have a fever, you should continue to stay home until your fever resolves. Okay. So this is for everyone. This is on the CDC site. These are the updated recommendations. COVID positive, regardless of vaccination state, stay home for 5 days. You can then leave with a mask on for an additional 5 days. Okay. If you were exposed to someone with COVID-19, all right. So a lot of us are walking around and we may not have it ourselves, but we may have been exposed to someone with COVID-19. If you've been boosted, like I've been boosted, if you've completed your first series of Pfizer or Moderna within the last 6 months, this is important. This is an important recommendation they have. Within the last 6 months of you being exposed, or you completed the one shot of the JJ in the last 2 months, okay? 2 months, then you should wear a mask around others for 10 days. Okay. 10 days, you should wear a mask. If you can test on day 5, then test on day 5. But if you develop symptoms, then you should definitely get a test and stay home. So an example of this is I had a patient come into my office. The patient came in for a pre-op appointment. The patient then left my office and went to have their COVID test done, which all patients are COVID tested before they have surgery with me. I received a phone call that day from the hospital to say that that patient was positive with COVID-19. I had just seen that patient in my office. Okay. Of course, I wear masks. All my staff wear masks. That's a requirement in my office, but I'm boosted. So I didn't stay home in quarantine for 2 weeks or 10 days. I wear my mask around others for 10 days, but I wear my mask in my office all the time. And I was more vigilant to wear my mask. Well, I wear my mask when I go out all the time anyway. Okay. But if you don't, then you should wear your mask for 10 days if you're exposed to someone with COVID.
So I'm thinking because so many people are not wearing masks.
Right.
And so then we don't really know. I mean, unless you're doing a test like you did at your office, people don't know if they have it. We don't know if we're exposed to people that have it. So the best way to protect ourselves is to
Wear a
just
mask.
wear a mask, right?
Right. And even individuals who are vaccinated and boosted, I want to be clear and for everyone, just because you're vaccinated and boosted doesn't mean that you can't pass COVID to someone else. Okay?
Say
You
that.
could you could have COVID and not have symptoms, or have very mild symptoms and not think of anything about it, and pass it on to someone else, even if you're vaccinated and boosted. Okay, so keep that in mind. All right, if you're exposed to someone with COVID 19, but it's been more than 6 months that you've received the Pfizer vaccination, or more than 2 months that you've received the JJ, or you're not vaccinated at all, then you should stay home for 5 days and continue to wear your mask around others for 5 days. Okay. If you cannot wear a mask, then you should quarantine for a full 10 days, they're recommending. Okay. If you can test on day 5, because again, the first few days when you get tested, it could be falsely negative, meaning you could get a negative test, but you truly do have COVID. So you want to wait for at least 5 days before you get tested if you're going to get tested. Okay. All right. So I'm getting towards the end of this talk, and before I talk about this, because these are our last 2 slides, I wanted to briefly talk about what you were talking about, Dr. Mike, about how the mask mandate are starting to be lifted. I think there's a lot of politics behind that. I do think that as we start to come into the season of elections, the different sides are looking at what is the best position they should take to get the vote. I'm just keeping it real. Okay.
Keep it real.
so,
Keep it real here.
so look at what's happening in Canada right now.
Oh my goodness.
Look at what's happening in Canada, and all of that is behind mask mandates. And to make the government stop these mask mandates.
And what's happening is it's a blockade, and it's funded largely by forces in the United States. What is that? So that's misinformation taken to the disinformation with a negative, diabolical outcome. I don't know what. It's hard to fathom why, people will. I want to help other people to be ignorant. I want to help other people to be sick. I want to help. Or even the question about, what do parents at school yelling at children who have a mask on, or threatening parents.
Right.
Why you're not going to make my kid wear a mask? And they're just all up in arms. That's more, I think it's a little beyond politics. It's
horrible. Dr. Mike, did you see that the clip of the mother who went to the school board? I don't know what school it was. I can't remember right now, but she went and was speaking at the school board, and she said that tomorrow I'm bringing my fully loaded gun. If you have a mask mandate, I will make my child wear a mask. I will bring my gun locked
go home and get every gun in my house
and ready to use it. Right.
But that person was arrested, by the way.
That is ridiculous.
Right. That's a threat.
That is a threat. That is ridiculous. But I think that what we have to do is sometimes we have to just clear the chatter. We have to clear all of that. And we just have to think common sense. Okay. While we don't want to wear these masks, who does? I don't. We don't. While we don't want to wear them, there's a reason why we're wearing them. And I think that we have to start thinking about not just ourselves, but others, because you never know the medical status or condition of someone else that you may come across who may be immunocompromised. Or you know what, Dr. Mike, they might not even know that they're immunocompromised, and they are. Okay. Because there's a lot of people walking around with conditions that they don't know that they have. So I just think that we have to be kind, and we have to think about the next individual, and we will get past this. We will. So preventative care is the best care. I always say, I think I end every one of my Doctor Knows Best articles in the Buckeye Review with that preventative care is the best care. And those preventative measures that were first put out when the COVID-19 vaccine came along are the same today. Get vaccinated and boosted is number one, because we know the research is there, the numbers are there, that it is the best way to prevent the spread of the COVID vaccine, COVID virus, and the morbidity and mortality that comes along with it. Wear a mask and double up if you can, as we demonstrated. You want to practice social distancing. If you can have a distance from individuals, please do so. Wash your hands frequently. I mean, I can't stress that enough, how important it is to wash your hands frequently. Clean surfaces frequently as well. Avoid high risk situations. If there's a crowd, or you're going into a room or an area that has poor ventilation, even if it's inside, then you might want to consider putting a mask on. Okay. Of course, functions outside are better because you have more air and circulation. Get tested. If you are having symptoms, acute symptoms are coming along, even if you think it's just a common cold, get tested. You don't know how many people, Dr. Mike, I have seen who think they just got a little cold, or, oh, it's just my allergies flaring up, and they get tested and they're positive for COVID. So get tested if there's any concerns. I had my boxes here, but I put them away. I just got my home COVID test through the USPS yesterday.
Okay.
So, I have those at home. Monitor for symptoms. If you know you've been exposed to someone, monitor for those symptoms and make the right decision. Don't go out if you're symptomatic. Get good rest, drink plenty of water, eat a healthy diet, healthy supplements, because these are all ways of boosting your immune system and trying to stay healthy. And I wouldn't be a good ear, nose, and throat surgeon if I did not add into there saline nasal flushes and flushing your nose with a saline rinse. It has been proven to help reduce upper respiratory infections. So I highly, highly recommend that to do regularly. You want to avoid getting caught up in all the hype. I mean, we have to try to avoid subscribing to disinformation. We have to question the sources that we're getting our information from, and we have to know whether they're reputable sources. People send me things all of the time. And the first thing, anything, Dr. Mike, that someone sends me, the first thing I look at is the source. Where did this information come from, and can I trust it? Okay. You want to encourage family and friends to get vaccinated and meet them where they are. Like I said, as a doctor, I don't beat people over their head if they haven't get vaccinated. I want to know where's the hang up? Where are you having a difficult time accepting it? And let me try to help you work through that. And that works so much better than bashing someone or trying to judge someone for not being vaccinated, because a lot of times their reasons are valid. You have to validate them.
So talk about the patient that was tested prior to surgery and was positive. Did you have to postpone the surgery?
Absolutely. That surgery got canceled. That surgery will have to be postponed. Yep. We do not put that patient to sleep. It was a surgery where I would have to work in their mouth and in their airway. And so that would not only put me as the surgeon at a very high risk of catching that infection, but it would put my staff and everyone else in the operating room at risk. Now, there are times where we have emergency surgeries that we have to do regardless of whether the patient is COVID positive or not. I've had to operate on COVID positive patients before because it was an emergency or urgency. And we do that in a controlled situation. We do it in a controlled room, a ventilated room, properly, specially type of ventilated room. And we're also completely covered, with special equipment and protective coverings. So yeah, that person was canceled and would have to be rescheduled.
Wow.
And lastly, give grace and understanding to our country's leaders, to our country's scientists and researchers, and to the healthcare providers. I mean, we tired. We tired.
I know you're tired.
We beat up. We are getting beat up.
Oh,
we are getting beat up. We never thought that we would be here 2 years later, but here we are. So we just ask that you give grace. I mean, I have seen more volatile patients coming to my office, or just the interactions are more volatile because they don't want to wear a mask coming into my office. I have refused to see patients, who come into my office and refuse to put a mask on. It is our protocol. We do not see patients who come in and will not wear a mask. We will provide you with a mask if you come without one. But I take care of some very sick patients. I take care of patients who have cancer. So I can't have another patient coming in and exposing them. I mean, just think about it, Dr. Mike. Just think about the kids. Think about pediatricians, right? When kids get chicken pox, right? The pediatricians don't want the kids coming in their office with chicken pox, right?
Hmm.
They
Right.
say come to the back door or come in another way to see the patient, or try to manage it if they can, over the phone, etc., because we know that that's a highly transmissible virus as well, right?
Hmm.
So it's the same thing with this. We know that this is highly transmissible. It's a respiratory virus. So we, as far as my office, we try to keep all of our patients in the best care and health as possible. And for us right now, that's a mask mandate in our office. And we hope that that changes as things change for the better with this virus, but that's the way it is now. So if there's any questions, I would be more than happy to answer them. I hope that the information I presented was straightforward and
Oh my goodness.
understandable.
It was phenomenal, and it was
Thank you.
powerful. And there are a few questions real quickly.
Okay.
Um, Talk about the home tests. Is there
Yes.
some efficacy there or some concern about false
So
positives or
there
that
is
sort
there are concerns, and they're valid concerns. Nothing is perfect. Okay, that's what I say. And the home tests are there, but this is what we have to think about. Okay, the home tests are there as a screen. All right, it's a screening type of test. We have to think about that. So if the test comes back as positive, well, it's highly likely that it's probably positive, but it doesn't mean it's 100%. The home tests are not 100%. So what I recommend is that if you do a home test, and to me, a home test should give you more awareness. Okay, it should make you sit up and be like, okay, let me focus here.
of.
You should always get that test validated. You can go and get, a PCR test through your doctor's office, or in a lab, or at the hospital, to confirm that. Okay. I'm not saying that you can't rely on the results of a home test. If a home test comes back positive and you're symptomatic, then guess what? Stay your butt home.
Right.
Okay. Stay
Right.
home,
Hmm.
for what is recommended. But if you have a positive home test, you're completely asymptomatic, no symptoms whatsoever, no fever, no nothing, then maybe you've not been exposed to anyone with COVID, no one that you weren't put in any high risk situations, then maybe you'll question that, but go get it verified,
Hmm.
because you don't want to just negate the result and say, that's false. You want to go and try to get it validated. But if you're symptomatic, listen, even Dr. Mike, even if the test is negative and you're symptomatic, stay your butt home. Stay
Right.
home.
Right.
You're
Right.
symptomatic. Stay home.
So here's a question: can I go around people that had COVID and aren't vaccinated, but are in that 90-day period where they may have
After
antibodies?
antibodies.
Right.
Yeah. So after that person who had COVID, and they're not vaccinated, after they have had COVID, their body is building up antibodies, right? So we
Hmm.
call that natural immunity. They're building up a natural immunity. Once they've gotten past their quarantine phase, and their isolation phase, once they've gotten past that, they're no longer symptomatic. Is it safe to be around that person? Theoretically, yes. Theoretically, yes, it is, but you still have to be safe yourself.
Hmm.
Okay. You still have to be careful and safe yourself, and use all of those precautions that we talked about. It would just be like if there was a person who was vaccinated and boosted and um, became COVID positive or got infected, right?
Hmm.
Even after that person were to go through their period of quarantine, that and no longer symptomatic, that person should be able to come out of quarantine and you be around that person. But if that person, regardless of whether they're vaccinated or not, if they're still symptomatic and they're having symptoms, then you should try to avoid contact with that person. Or if you can't avoid contact with that person, then you want to take the precautions, double masking, washing your hands
Mhm.
frequently, trying to social distance, from that person.
And so, since tests are available for free, we can get them in the mail. When should a person test themselves? Is there a recommendation that should it be symptomatic, or should just do it?
Right.
Or,
Right. Well, just like on the recommendations for on the slides that we went through,
Mhm,
that if you're exposed to someone who is COVID positive, then do that. If you've been vaccinated, etc., then you don't have to quarantine. You would just wear your mask for 5 days, but then you want to test at day 5. Okay. Because you can test too soon. If you test too soon, your test might come back negative when it
mhm,
really is positive. So go ahead and test at day 5 if you're not symptomatic. If you're symptomatic, you are having symptoms. If you've been exposed to someone, with COVID-19, go ahead and test. If you're symptomatic,
mhm,
test.
mhm.
Yes, if you're symptomatic, test. But if you're not symptomatic at all, then you may want to wait, a little bit because there's going to be that incubation period, you
So, what
know.
about travel? Because of the airline industry, do you think those home tests are valid for travel and airlines?
You
You may or
know,
may not know that. I don't know.
honestly, it's what we have. The home tests are good, but they're not perfect. That's how we have to look at it.
Hmm.
And when you're traveling, I would say I would rather take a home test than no test. It's kind of like a mask. You may not have the perfect mask. You may not have a hospital grade N95 or big, respirator, but it's wearing a cloth mask would be better than not having any mask, right? And not having
Hmm.
any mask. So the same thing with the home test. It's better than not having anything. It will help to guide you, in your decision making process. So we do have to rely on those home tests. They're important in our whole fight against COVID. But just I want people to remember, I don't want people to have a false sense of security if their test comes back negative and they're symptomatic and say, oh, well, okay, I might, have a sore throat and runny nose and cough, but my home test was negative. That doesn't necessarily mean that you might not have COVID. You may want to go get another test so that
Hmm.
you can, prove whether that was a false
Sure.
negative or not.
Well, you've given us some great information, and I want to remind our followers and listeners, or those who are paying attention, that you can watch this later. You can tell your friends about it. You can send a link from Facebook or YouTube to your cousins by the dozen. You can go back and listen to it another time because it was a lot of information. Also, the references were listed on the
Yeah.
slides. So it's very credible information. And of course, pick up the Buckeye Review or subscribe so you can hear from Dr. Tony Farmer. Doctor knows best in her
Doctor knows
power.
best.
Thank you again so very much, Dr. Farmer, for this great information and presentation. And I will say one more thing, and you said it, and people commented on your on what you said, and I think it summarizes beyond the scientific information was be kind.
Be kind.
If we're going to
Yep.
be kind to one another, we need to be kind to one another, love one another by wearing a mask, doing the best that we can. We do the best we can for our children, and we should extend
Yeah.
that to our neighbors and our community as well. So that's what we're trying to do in combating misinformation and disinformation. So, again, thanks to Dr.
Yeah.
Farmer. Thanks to those who may have chatted in or watched or listened. Next week, or we'll be back probably tomorrow or the next day with another Facebook Live. But I should mention that in particular next Thursday, we're trying to do it every Thursday in the month of
Hmm.
February. So next Thursday we'll have some mental health professionals, and you want to let people know about, because mental health is obviously a big deal that's going on now, and we want to combat disinformation in that space as well. So thanks again, Dr. Farmer. Thanks
Thank
to all of
you.
you, our Facebook and YouTubers out there. We hope to grow that audience. And if we're more consistent, I know we'll grow the audience. So
Oh, it's Dr. Mike, I have to say, this is an amazing platform. I'm excited to see the growth of the platform and where the Buckeye Review is going to go. And, being able to have this and come on live and really get into the homes of people. This is amazing. It's
Mhm.
amazing. And I'm grateful and thankful that you invited me and that I can share what I love, with other people.
So I'm saying do something new in 22.
Yeah.
So that's what I'll let that be the closing word. Stay safe, vaccinate, wear your mask, and do the right thing. So again, God bless you. God bless you to our listeners. We're done. We're out.
Thank
See you
you.
next time on the Buckeye Review Update. Bye bye, everybody.
Bye bye.